exercise and just seeing how the length of your muscle right now. And so I want to do a pre-test and post-test because, like I said, cupping helps to increase the flexibility. So if we do a pre-test and post-test, we can see the progress of it more easily. Okay, so now you can just relax your leg for me. If I move your hip at 90 degrees. You can see about right there. That's like maybe lacking like 45, 50 degrees there. It's not an accurate measurement, just a rough estimation. And then we can see on this side. This side is about, I think it's actually even tighter. If this is 0, this is even lower. You probably are lacking 50 or 60 degrees there. So we will just do on the left side and then compare that to, I'll do on the right side and compare that to the left. Okay.
But it doesn't really hurt too much when. Okay. Just do it. Okay. It doesn't really hurt. Maybe we'll just do like a bolt close thing. We'll try it out. But like it hurts, but like do this. Like okay. Oh no. But okay. Got it.
They'll only pull out the stuff for you with the
Oh cool.
Oh shoot.
What's that feel like, Sai?
That's weird.
Oh, I just kicked something over. Does that got a lid on it when I kicked over?
So, if y'all are gonna be noisy, should we shut y'all's door?
Yeah, show the door.
It's not too painful, right?
No, it's not bad.
It's just
It
odd
feels,
sensation,
yeah,
right?
it feels weird, but it doesn't hurt.
Yeah.
Oh, that's so weird.
Yeah. So now, Silas, I will need you to kick your knee straight. And then...
How's that feel,
bend
Silas?
back down.
Does that feel strange?
Yeah, it's weird.
Yeah. And then keep bending. Again, kicking. Yeah. Keep going like that. That feels tolerable, right?
Yeah.
Once you are used to that, I will move your leg even higher. So bend both of your knees up a little bit more, like bending closer to your chest. Both of them. Yes, so I'm putting your muscle on more stretch. Now, go ahead, kick the leg straight, and then relax. Keep going. So you can see it's creating mobilization under the cup
Totally.
because of lengthening and shortening the muscle. And then that's actually facilitating more blood flow into that area. And the reason why a lot of people are concerned about bruising is usually because the cup is staying in the static position for too long. However, if you're able to incorporate some active movement in it, it can significantly reduce the amount of bruising afterwards. Does you feel okay?
Yeah.
Okay. Okay, now you can relax, Silas. And then another thing to do is you can also mobilize the cup. So that can help with lengthening and mobilizing the tissue in different parts.
What's that feel like to you, bud?
Weird. It's like I don't even know. That
Is
one
it-
hurts a little.
Does it hurt a little bit?
Yeah.
As a whole, does
this
it hurt,
one-
or just that one?
When it's getting closer to the tendon,
I
it's
think
probably
this one.
tighter.
Yeah.
And closer to that IT band too.
Okay, now I want to progress that even more, so we'll need you to roll onto your back. You can keep both of your legs bent. And you move your leg. Then now, go ahead, kick your leg.
Oh dang.
And then keep going, do some more active range of motion. Like in this range, you are able to move your leg even more, so we do that.
Does that feel looser than earlier
Oh, yeah,
already?
Yeah, definitely.
I think we are already, like, that's not even post-test.
Like
you
I
can
was like
already
here.
see-
Now
Yeah,
I'm
so
like,
your range is already improved. Okay, now we can relax. And then to release it, it's very easy. It's just pulling.
what?
Yeah, it's just pulling, and then the pressure is released, and it's not. So, and then
Where was it?
yeah, so it was there.
Oh
And
yeah.
then I do want to apply a little bit aftercare, which is just rubbing the area a little bit more. Like the very key thing to do to minimize bruising is just to add a little bit
Yeah.
of massage. Then that helps to minimize the bruising. Okay, now time to retest. So we didn't do any treatment on the left side, so I wouldn't think there's gonna be any changes. Yeah, so it's still about right there, around 45, 50 degrees from vertical line. Let's see. Let's look. Straighten this knee out. That's significantly better because that's 0 degree, and then I think now we are lacking like about
15.
30, maybe 30 degree. Yeah, but then earlier we were even below the 45 degree line, like 50, 60 degrees. So
Can you feel that difference, Silas?
Yeah.
that's significantly different.
Yeah, I can see it.
Yeah, like, that's very clear because it's like below 45, above 30, above 45.
Yeah.
So that's significant. And then that just took about like not even 5 minutes to set up everything. That's a very effective treatment option to improve range of motion.